A 42-year-old man presented to the emergency department with productive cough, fever, chest pain, shortness of breath for the past 4 days. On examination, his temperature is around 102 degree Fahrenheit, pulse is 105, respiratory rate is 30. Okay, the chest examination revealed decreased breath sounds, crepitations in the right lower lobe. His white blood cell count is elevated. The chest X-ray showed homogeneous ground glass opacity in the right lower lobe. Okay. So basically, guys, this is what is the logic, that a single line can give you a perfect hint that what you are dealing of. So this single line is telling up that there is a homogeneous ground glass opacity in the right lower lobe, and his sputum is collected for the lab investigation. So what do you think it is? Now, the provisional clinical diagnosis of this particular case is no doubt what? It is a Lobar pneumonia. Okay, Lobar pneumonia, and the lab investigations include what? You can go for the direct microscopy of the sputum and the culture of that particular one. Okay, and culture is routinely done on what? On the blood agar and the McConkey agar. These are the ones in which we do the culture. The culture growth on these particular culture media is identified by what? Morphology. You can identify colony morphology. They have different one. Gram staining from the bacterial colony, biochemical reactions and other tests will confirm your diagnosis. Okay. So guys, one thing is for sure, that you're dealing with a Lobar pneumonia, and in that, you know, the most common cause of that is what? Streptococcus pneumoniae. What else you can focus upon here? That this is a Lobar one, an atypical one which is not extra Lobar. That is atypical pneumonia, that is being done by whom? Mycoplasma pneumoniae, which is the most common cause of it. Then you have chlamydia stuff, that is chlamydia psittaci or chlamydia pneumoniae, and even the Coxiella burnetii. They associate with what? Atypical pneumonia. That is, atypical means extra Lobar. Besides this one is Lobar. The most common is Streptococcus pneumoniae. And if somebody asks you which is the most common cause of CAP, that is community acquired pneumonia, answer is